Why coronavirus is so easy to spread in the community is that infected persons have an incubation period of about 14 days, and there are no obvious surface symptoms. Many people do not know if they have been in contact with incubators. We use a smartphone app and also to install access terminals in public facilities. The only person that is not in our suspected incubation list can get a green go signal to access. Let me demonstrate how it works. The system consists of two parts, the client's mobile app and the dedicated terminal to be installed in public areas such as restaurants, cinemas or a library. The mobile app can be downloaded from Google Play or iOS Store. During the installation, the app will ask the user for his or her mobile phone number. A QR code will then be generated on the screen. Anyone wants to access a public facility, they will be asked to get the QR code scanned by the access terminal at the entrance. Here are two facilities A and B. User 1 and 2 are accessing the facility A while user 3 and 4 to facility B. A green tick on the terminal display means they are good to go. Two days later, user 4 has confirmed coronavirus infected. The medical authority needs to report to our system. Staff from the medical authority needs to enter the mobile phone number of user number 4 into our system through a medical terminal. Now, the user 4 phone number is entered on the terminal, and the record is transmitted to the server. The server immediately puts all persons, who appear in the same place, at the same time, as the confirmed patient in the past 14 days, into an alert list, and transmits it to all access terminals. Now we can test if all access terminals will block the access of user 4, and also user 3, because user 3 went to the same facility B before. The display on the access terminal denies their entry from 1 to 14 days, depending on the date they shown up the facility, with the infected person. However, it should not affect users 1 and 2 because they have never shown up on facility B at the same time with user 4. Users 1 and 2 have no problem with accessing facility A and facility B again. This is a simple illustration of how the system works. We have built a mathematical model. With a 10% public participation rate, the system can reduce the total number of infections by more than 40%. With a 30% public participation rate, the system can reduce the total number of infections by more than 80%. This is the most effective way to control the coronavirus without locking down the economic activities.